So hello to everyone. Today, coming with a video after a long gap. I thank you for watching my videos. I hope these topics can reach more and more undergraduate students, as well as those who are interested in reading such topics. So today, I've come with a very short one on a topic called the cervical lymph nodes. So we're going to discuss not about all the cervical lymph nodes, just about the concept or the which is based on the levels of cervical lymph nodes. So there are a number of classifications, American Association, now the HACC. So we have the one that is described commonly and is used widely in India is the 7 levels of cervical lymph nodes. So let us just go through that. So different levels of cervical lymph nodes and its surgical relevance. So there are 7 levels of lymph nodes in the neck. So we have the level 1, which has the level 1A and the 1B. 1A refers to the submental nodes, that is below the chin, and level 1B refers to the submandibular nodes, that is on the side of the jaw. Level 2, level 3, and level 4. These are nodes along the jugular vein. So the upper one-third is called the upper jugular nodes, then the middle jugular nodes, and the lower jugular nodes. And level 5 refers to the posterior triangle nodes. And level 6 includes the nodes on the anterior aspect of the neck, that is in front of the trachea, larynx, and the cricoid cartilage. So we have the prelaryngeal, precricoid, pretracheal, and the paratracheal nodes in this group. Now level 7 is described in the AJCC. So that includes the upper mediastinal nodes, basically from the suprasternal notch up to as low as the right brachiocephalic trunk. In some cases, they say the arch of the aorta. So basically, it is all the nodes up to the right brachiocephalic trunk is included in the level 7 nodes. Now, like I mentioned earlier, there are other associations which have the same classification for the cervical nodes. They usually commonly include level 1 to level 6. Another point I want to mention here, this is slightly simplified. So we have subcategories just like 1A and 1B in 2A, 2B, 4A, 4B, 5A, 5B, like that. But we're going to keep it a little simple. So this is how it looks like. Level 1A and level 1B, level 2, 3, and 4. Now 2 again is divided 2A and 2B by the spinal accessory nerve. Similarly, level 5 is also divided into 5A and 5B. It is based on the omohyoid muscle. Then there's level 6, which is the front, and level 7, which is the upper mediastinum. So this diagram may be useful for diagrammatic representation of the same. So now let us see the surgical boundaries of each level. Now level 1A, it is bounded by the anterior belly of the digastric muscles on either side. Superiorly, it is bounded by the symphysis of the mandible, and inferiorly by the body of the hyoid bone. So basically, it's an area which is below the chin on one side of the neck. So anterior belly of digastric muscles on either side, the superiorly by the symphysis, and below the inferiorly by the body of the hyoid bone. Now level 1B, it is bounded by the anterior belly of the digastric muscle medially, stylohyoid muscle laterally, posterior belly of digastric inferiorly, and the body of the mandible superiorly. So that is level 1B. So basically includes the area where the submandibular gland is present. So once again, it is the anterior belly of the digastric medially. So that is the same boundary as the level 1A. Then you have the posterior belly of digastric inferiorly. You have the styloid muscle laterally and the body of mandible superiorly. So if you imagine this as I say it. Now level 2, it extends. Now level 2, level 3, level 4 slightly easier because it's got a synchronous nature in the level. So level 2 is it extends from the level of the base of skull superiorly to the hyoid bone inferiorly, and that corresponds to the upper one-third of the internal jugular vein. Level 3, It extends from the hyoid bone superiorly to the level of the lower border of the cricoid cartilage inferiorly. And this is related to the middle one third of the internal jugular vein. Level 4, it extends from the level of the cricoid cartilage superiorly to the clavicle inferiorly, and it is related to the lower one third of the internal jugular vein. Level 5, it is bounded by the posterior border of the sternocleidomastoid muscle anteriorly, and the anterior border of the trapezius muscle posteriorly, and the clavicle inferiorly. So you have to imagine the entire space, including the supraclavicular space, which is behind and lateral to the sternocleidomastoid muscle, going all the way up to the trapezium in the back, trapezius muscle, and in the front up to the clavicle. Now level 6, it extends from the hyoid bone superiorly to the suprasternal notch inferiorly, and laterally it is bounded by the carotid sheath on either side. So it includes all the area which is not included in the level 2, 3, and level 4 on either side. Now, level 7, it extends inferiorly from the suprasternal notch into the superior mediastinum up to the level of the right brachiocephalic artery. So I hope you're well versed with your anatomy, and this has helped you to imagine it. Now, a few words about the surgical relevance of these levels. What is the importance of having these levels? So, nodes in each level, they receive lymphatic drainage from specific areas of the head and neck region, thorax, and the gastrointestinal tract. So, enlarged or palpable nodes in each level is an indicator of a primary cancer site or a disease pathology in their corresponding drainage area. So, this we shall see to what are the drainage areas. So, now level 1 I've comprised both of them together. Oral cavity, that includes the cheek, gums, that entire the tongue, everything is included in the oral cavity. Then the lip, the salivary gland, again we refer to the submandibular gland, and the skin. Now, if you had to look at more specifically, then level 1A would correspond to the tip of the tongue, the middle of the central portion of the lower lip, so like that. So it appropriately, and 1B would correspond to the lateral aspect of the lower lip, the upper lip, then the submandibular gland, uh, then the anterior tooth of the tongue, the skin. So like that. So it depends on the. So I'm generalizing it right now to make it easier. Now level 2 again includes the oral cavity, the nasopharynx, oropharynx, larynx, and then salivary gland. This includes parotid as well as submandibular. Level 3, oral cavity, oropharynx, hypopharynx, larynx, and the thyroid gland. Level 4, oropharynx, hypopharynx, larynx, thyroid, cervical, esophagus. Level 5, nasopharynx, scalp, gastrointestinal tract, breast, lung, thyroid. So you can imagine level 5. So it's a portion where actually you can have even a metastatic node from the GIT or the lung or the breast. Now level 6 generally involves the malignancies from the thyroid gland. However, even the larynx can have nodes enlarged in this area. Now, level 7 again I told you it is beyond the neck classification. So however it again represents the upper mediastinum, so I'm not including that into this. So just for this is the common things that are that this particular 6 levels represent the common diseases and their drainage areas. And everywhere there can be a slight overlap of other areas, but I have mentioned the majority or the more important areas that drain to that particular level. I hope you have a brief idea and have understood the lymphatic drainage in that is the site in the head and neck region and the corresponding level in the cervical lymph node. So that is what is important for the undergraduate level. Of course, for a postgraduate level, the surgical technique and the operative technique based on such a cervical lymph nodes is also important.